Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OIT training. Welcome back to Magic Pill session, and today we are going to discuss very important topic, that is neonate and infant disorder. We have taken the topics and the questions from previous year question papers. So whatever the questions we are discussing, it is very useful for you. And not only we are discussing the MCQ point, we are also discussing the additional vital points. So in the future examination, you can expect questions from here. So watch the video till the end. Definitely it will be so much useful for you. And if you like the video, please like it, share it, subscribe the channel guys. Most of the students are watching the video without subscription. So please subscribe the channel so that it will motivate us to post more and more videos. Okay, so with your motivational thoughts, we can start the session. The successful warrior is the person that is average man with laser-like focus. See, an average man who is achieving the success mostly, have you seen? See, those people are only the average persons. Okay, but they are reaching the goal. Why they are reaching the goal? Because the focus is very clear. The target is very clear. That's why they are reaching the goal very easily. So this is the motivational thoughts. With this thought, let's begin the session. As I mentioned already, newborn and infant disorder, MCQ and vital points we are going to discuss. The first question is, newborn has mainly which vitamin deficiency? This is a direct question. This question asked in AIIMS NORCET examination, and they have given 4 options like vitamin B complex, vitamin K, vitamin C, and A. So here the right answer is option B, that is vitamin K. The newborn has mainly vitamin K deficiency. Okay guys, so this is the answer for this question. Now let's discuss the additional important points. See, the vitamin K, as you all know, it is a fat soluble vitamin. Okay, this is the first golden point. It is a fat soluble vitamin. The next important point is vitamin K production is very easy for the adult. Why? The gut, that is in the intestine, vitamin K is produced. Where the vitamin K is produced, it is produced in the gut, that is in the intestine. Okay, how? With the presence of or with the help of bacteria, the vitamin K is produced in the gut or in the intestine. Okay, so this is the second important point. So for the children's, that is for the newborn, see, once baby is delivered, so for that baby, the gut will be very clear. That is, sterile gut will be there. In that sterile gut, the bacteria will not be there. Okay, so for the adult, the bacteria will be there in the intestine. So production of vitamin K is very easy. Whereas for a newborn, the sterile gut will be there. There is no bacteria in the gut. So production of vitamin K is affected. So the newborns are high risk for developing the hemorrhagic disease. Okay, because of lack of vitamin K. Obviously, some amount of vitamin K, it will be present in the liver, but it is not adequate. Okay, the vitamin K has to be produced in the gut by the bacteria, then only the vitamin K will be adequate in the body. So, okay, so till the development of the vitamin K or till the development of the bacteria in the gut, we have to give the vitamin K as an external source. For example, intramuscular injection of 0.5 to 1 mg of vitamin K has to be recommended or has to be administered to the newborn in order to prevent the hemorrhagic disease. Okay, so what are all the points we discussed? It is a fat soluble vitamin, and for the adult, vitamin K production is done by the bacteria in the gut, and for the baby, that is newborn baby, the gut is totally sterile, clear, without bacteria. That's why they are prone for or getting the risk for developing the vitamin K deficiency and hemorrhagic disease. So the source of vitamin K for the newborn is, we can administer 0.5 to 1 mg of vitamin K, okay, for all the newborns. Okay, fine. So the next question is also related to vitamin K only. So this question asked in ESIC exams, the nurse administer an IM injection of vitamin K to a newborn. Okay, it is a direct one. To a newborn, the nurse is administering the IM injection, vitamin K IM injection. What is the purpose? They are asking the purpose. Why we need to administer the vitamin K injection for the newborn. Okay, so 4 options they have given here. Among these, the right answer is option D, that is provide protection until the intestinal flora is established. Okay, so the vitamin K, why the nurse is administering vitamin K as a IM? So it is protecting or providing the protection until the intestinal flora is established. In the last slide only, we have discussed all the golden points which is related to vitamin K. This question is also more or less related to that only. Okay, till the intestinal flora development, it is giving the protection against the hemorrhagic disorders. That's why we selected option D. Okay, what are all the other possible question which is related to vitamin K so far asked in the examination? That also we can see now. Okay, so these are all the other possible questions so far asked in the previous year question papers. Okay, so for the first one, it is asked in AIIMS and as well as DSSSB exams. Okay, so hemorrhagic disease of the newborn is caused by the deficiency of which vitamin? The answer is vitamin K. Okay, the second question, this question asked in PGI Chandigarh. Vitamin K at birth is administered to dash among infant. Why we need to administer vitamin K? For the infant to prevent excessive bleeding. Okay, even though it is simple, but still these are all the questions so far asked in the examination. You want to be very clear. I want to be very clear with all the questions so far asked in the exam. Okay, so that's why I added everything. The third one is this question asked in RUHS. Dose of vitamin K in premature baby is, in a premature baby is 0.5 mg. Okay, the next one, there are two types of vitamin K, guys. Vitamin K1, vitamin K2. Vitamin K1, it is also called as piloquinone. Okay, it is mentioned here, piloquinone, that is vitamin K1. And vitamin K2, it is called as minoquinone. Minoquinone. Okay, see, vitamin K, it is found from the green plants, plant source. Vitamin K1, where it is found? It is from the green plants. Green plants are the source of the vitamin K1, that is piloquinone. Okay, and another form of vitamin K which is produced by the bacteria in the intestine, that is called as vitamin K2. Okay, that is minoquinone. Okay, guys, so this is the difference between vitamin K1 and vitamin K2. K1 is a plant source, K2 is by the bacteria in the intestine. Okay, guys, fine. So the next question is, the newborn baby may go into the hypothermia within 1 hour of the birth with temperature falling below. Actually, they are asking the temperature after delivery of the baby within 1 hour, when we have to consider the baby is in the hypothermia. What time we have to consider the baby is in the hypothermia within 1 hour after the delivery of the baby. This question is asked in AIIMS NORCET examination. 4 options they have given here, and the options are given in the centigrade. 36.5, 37, 37.6, 36.8. 4 options they are given here. And here the right answer is option A, that is 36.5 degrees centigrade. If the newborn baby within 1 hour of birth, consider as hypothermia means the temperature has fallen below 36.5 degrees centigrade. Okay, fine. So let's see the additional vital points which is related to this question. See, hypothermia in the newborn means the axillary temperature of the baby falls below 36.5 degrees centigrade. That's why we selected this option. Okay, if they are asking in centigrade, that is 36.5 degrees centigrade, or if they are asking in Fahrenheit, that is 97.7 degree Fahrenheit. Okay, this is given by WHO, World Health Organization. Okay, so the next one is the normal temperature in newborn. So let's discuss first about the normal temperature in newborn. Okay, so the normal temperature in newborn is 36.5 degrees centigrade to 37.5 degrees centigrade. If they are asking in Fahrenheit, 97.7 degree Fahrenheit to 99.7 degree Fahrenheit. Okay, I'm talking only about the axillary temperature. Okay, so the third important point related to this hypothermia is stages of hypothermia. So actually, the hypothermia, it is classified into 3 types. Okay, so mild hypothermia, moderate hypothermia, severe hypothermia. These are all the 3 types or 3 classification of hypothermia. Okay, so mild hypothermia, you can see everything is given in centigrade. Please convert into Fahrenheit also. So it is given in centigrade, that is mild hypothermia means 36 to 36.4 degrees centigrade. Moderate hypothermia means 32 to 35.9 degrees centigrade, and severe hypothermia means less than 32 degrees centigrade. Okay, so all these things are very important vital point. Please make a note of it. Okay, guys. So for this question, option A, 36.5 degrees centigrade is the right answer. The next question is, what is the yearly onset neonatal sepsis? Yearly onset neonatal sepsis. Actually speaking, there are 2 types of neonatal sepsis. One is early onset, one is late onset. Now in this question, they asked about yearly onset neonatal sepsis. This question asked in DSSSB exams. So 4 options they are given here: infection within 12 hours, 72 hours, 24 hours of birth, 48 hours of birth. 4 options they have given here. So here, early onset neonatal sepsis means the infection within 72, underline the word, within 72 hours of birth. Option B is the right answer. So what are all the additional points which is related to early onset neonatal sepsis as well as late onset neonatal sepsis, that also we can discuss now. See, early onset sepsis develop within 72 hours, or already we discussed that. What are the risk factors for early onset neonatal sepsis? You can see the risk factors very clearly here. Maternal fever, prolonged rupture of membrane, foul-smelling liquor, multiple per vaginal examination, even low birth weight babies or coming under the risk for early onset sepsis. Okay. Apart from that, now we can discuss about the late onset sepsis. See, late onset sepsis means the sepsis which develop after, underline the word after 72 hours. Within means early onset. After 72 hours means late onset late onset sepsis. Okay, and it is caused either because of nosocomial infection, it is also called as hospital acquired infection or community acquired infection. Okay, the next one is risk factors for late onset sepsis. What are all the risk factors for late onset sepsis? Again, low birth weight baby, lack of breastfeeding, poor cord care, and infection. Okay, so all these things are very, very vital point which is related to neonatal sepsis. Broadly classified into two: early, late, and the risk factors and the duration. These 3 points are very important golden points for this question. Okay, fine. The next question is kangaroo mother care. Which of the following is true? They are talking about kangaroo mother care and they are asking which among the following is true. This question is also asked in DSSSB exams. 4 options they have given here. Can be done by father also. Indicated for low birth weight babies. Effective thermal control. All of the above. So what do you think? Which is the right answer? So here the right answer is yes. All of the above. Okay. So why all of the above? The rationale is, see, kangaroo mother it can be done for all stable. Usually it is done for the low birth weight babies. Okay, whether the baby weight is more than 1800 gram or less than 1200 gram, whatever it is, low birth weight babies, we are giving the what kangaroo mother can make sure that the baby is stable. Okay, so till the baby is stable, once the baby is stable, we can provide the kangaroo mother care. Okay, so that is the important point. If the low birth baby, the baby is stable, then we can provide the kangaroo mother care. Even the mother is not available. If the mother is sick, even the father or other family members also can give the kangaroo mother care. Okay, the next important thing is the minimum duration of the kangaroo mother care should be at least 1 hour. At least 1 hour. Okay, but the recommended one is, this is the recommended one. The duration of the kangaroo mother care is classified as follows. You can see here it is classified into 4 types, that is short duration, extended duration, long duration, and continuous. Short duration, it extends up to 4 hours daily. Per day, 4 hours. That is coming under what? Short duration. Extended duration means 5 to 8 hours daily. Long duration means 9 to 12 hours, and continuous means more than 12 hours. We can provide the kangaroo mother care. Okay, guys. Fine. So these are all the important MCQ questions as well as the golden point which is related to the questions. Okay, hope everyone understand the concept. If you have any doubts anywhere, you can drop your questions or queries in the comment section, and please follow this Magic Pill session. And also we are updating the job updates and whatever the important thing coming related to the nursing point of view, we are updating each and everything. So watch the video, please subscribe the channel so that whatever the video we are posting, it will reach you then and there. Okay, so subscribe the channel, and if you like the video, please like it, share it to others also, guys. So thank you very much for watching the video.